Now, it's not uncommon for older people to downplay decline, to ignore symptoms, insisting they're fine because they don't want to be a bother, a burden, or make a fuss.
Brightly lead clinical pharmacist Julia Brooks is going to tell us how to deal with someone you love who is in denial or resistant to getting help. I'm sure this episode is going to be very useful. Julia, older people seem to be hesitant to speak up about changes or side effects from medications or differences in their pain levels. Sometimes I wonder if it's because they put it all down to ageing. Sometimes I wonder if it's just because they're plain stubborn and they don't even want to acknowledge it. But you're the expert in the room. What's your view on that?
Well, you're right on both counts. I mean, a big part of it is that a lot of the issues that older people face that are, often health condition or medication related, people just put down to ageing. Things like unsteadiness or being more forgetful, or their vision not being as good, their hearing not being as good, their pain being worse, even low mood and just feeling, having low levels of energy. All of those are potential medication side effects, but people assume that they're a normal part of ageing that just has to be accepted and sucked up and got on with. So that's definitely part of it. But the flip side of it is most older people are of a generation where you suck it up and get on with it. They don't want to make a fuss. They don't want to cause a problem. They don't want to be the focus to be on them. They don't want to be a burden. Absolutely. And so, and I hear it all the time. I have patients saying to me, I didn't want to make a fuss, or I just thought that was, something I had to deal with because I'm getting older, or, I don't want people to worry about me. That's all, they're often doing it out of a sense of, what's the right word? Care for their family. They don't want their family to worry. And if they start raising issues and concerns, people might worry about them. And they want their family to go off and live their life. And in the worst case scenario, I think it's worst case in my opinion, because it's often reversible, it's because they are worried that if they let on that something's wrong, somebody might take away their driving. Somebody might figure out that there is a problem there that can't be fixed, and they would lose their independence. But often the problem that they're concerned about actually, can be managed or reversed, or at least that problem slowed down, but not if we don't know about it.
Are there common health issues that older people particularly underreport?
Yes. I mean, all of those sort of ageing symptoms. Right. So dizziness, being unsteady on your feet, sort of low-level memory issues. You start not being able to, recall people's names, or you get muddled, or you lose your keys all the time. You can't remember where you park your car, or you have to use a calendar, and otherwise you won't know what day of the week it is. Things like you're developing blurred vision, even though you've got new glasses, but it's still not quite right. Constipation, frequent urination, or worse, incontinence. All of those things which might be part of ageing also often can be reversible. They can be medication side effects or conditions that just need treating that aren't being treated. So, if you suspect that if there's anything wrong, if there's anything new, you should talk about it, 100%.
Are there any signs that we should be looking out for someone who's minimising how they're feeling or what they're experiencing from a health perspective?
So if you're a loved one and you've got an elderly parent, and you're wondering if there's anything that you could be doing to support them, but they insist that everything's fine, there are signs. There's always signs. So I think that's what you're talking about. What would you look out for? So things like, some of them are really obvious, things like falls and pain. If somebody's not mobile, if they're struggling on the stairs, if they can't carry their shopping from the car to their house, that those signs are signs of frailty, that things are deteriorating. Things like they're needing a lot of tools. They carry a notebook everywhere. They're writing everything down. That can be a sign that they're trying to compensate for memory problems or changes in their cognition. Having to repeat yourself a lot, telling people that tell the same story again and again, that's a sign of early cognitive changes. And just sort of general unsteadiness. If you find that they are holding onto walls or furniture as they walk, all of those sort of subtle, they're looking more old. A lot of those are reversible or slower downable. We can actually de-accelerate those aging.
Slow the decline.
Yeah, slow the decline. But only if we do something. So watch out for those. The next problem comes getting that person to engage. And the best way to do that is to talk about optimizing the aging process or slowing down the aging process. Don't talk about the problem as something to be solved. Talk about the person as someone you want to preserve.
Do you have a particular approach when someone comes to you who's unwell? How you go about finding out what they need?
Absolutely. I mean, it very much depends on whether they know that there's an issue or whether they have been referred by someone and they don't know that there's an issue. So if you've got somebody, say, on medications that could potentially be doing harm, but they're very attached to those medicines, essentially the answer is almost always the same. It's empathy and education. So acknowledge that the person is autonomous, that they are in control of their body and their future, and that you're here to help them understand better so they can make better, choices for them. You're not trying to push them or lead, you may be trying to lead them or guide them, but that it's a collaboration. I think that's the really important first point is I'm not the boss of you. I'm not going to tell you what to do. I'm certainly not going to take anything off you. It has to be a collaborative approach. It has to be us teaching you about your medicines, about your health condition, and about what healthy aging looks like. So then you can say, actually, I want that for me. How do I get that? Not you're doing these things wrong and it has to be this way. The minute that you start trying to push people or put them in a box, people push back and then you don't really get anywhere.
So often, life is about hearing the right message from the right person at the right time. And when you're starting to wade into some clinical conundrums and highly emotional situations, I could be suggesting something to my parents quite genuinely, and I am wanting to optimize their health and I am wanting to slow their decline, but they don't want a bar of it from me. And
why would they listen to you?
Exactly. And they sort of revert me back to a teenager or something. What would I know?
Family dynamic.
And I understand that, but I still want that outcome from them, and I think they still want it for themselves. But
they want the autonomy.
Yes,
they want the control, the autonomy. That it's really it's a real problem in this field of geriatrics or older adults, that because people become more dependent as they age, we forget that they are fully grown, fully functioning adults with the right to make their own decisions and be self-determinant. So they need advice provided to them. They don't want to be told. So often the way as a family member to get them where you're hoping to get them is somebody that's not you. You need an independent expert. You need somebody that's not invested, that's not biased, that's going to give them the advice and the education and the information, and they have confidence in that person because they're an expert. They trust that person because they have the right credentials. It's not their daughter having heard something on a podcast. Or that. Get that. But get that specialist in front of them.
Yes.
Empower them to make those decisions. Obviously this is my specialty area, and I'm lucky that for the most part my parents do take my advice, but often it takes a little bit of encouragement. And this is my bread and butter. So having that specialty input, that independent advice, can make all the difference.
And so, is the one piece of advice that you would say or give to families dealing with this stage in their parents' life?
Is if you can afford it, get independent specialist advice. And as far as I'm aware, Brightly is the only people that are doing it in New Zealand. It's a multidisciplinary team of specialists. So you've got, myself as a clinical pharmacist, you've got a geriatrician, you've got a GP with a really strong background, you've got nurses doing assessments that have worked with older adults for a long time, clinical psychologists, physiotherapists, occupational therapists, the whole wraparound, even legal advice, that wraparound specialist care that you actually can't get anywhere else. The only time you have access to that sort of level of wraparound service is if you have had a significant medical event and ended up in hospital, usually a broken hip or a broken, something else. A really scary statistic is that 25% of New Zealanders who break a hip are dead within 2 years. We need to prevent that fall, right? We need to prevent that fall from happening in the first place. And that means holistic, proactive, wraparound geriatric care. But it's not accessible through your GP. It's, occasionally, if you're high risk, you may be able to get referred to see a specialist at the hospital, but you're seeing one specialist. You're not seeing a whole team that's looking at the whole picture. And that's the difference with Brightly. So if you can afford it, I would highly recommend a specialist review.
Well, Julia, lovely to hear that, and thanks so much for that valuable advice. It's really been great talking with you.
It's been a pleasure. Thanks for having me.
If this conversation struck a chord, we've gone deeper into this topic in our full-length episode. It's called Can Managing Your Meds as You Age Help You Live Longer? And it's certainly well worth a listen.
And if you're worried about someone you love, or even yourself, Brightly can help you make sense of what's going on. We look at medications, health changes, and everyday signs together so concerns don't get brushed off or missed or just put down to I'm getting old. You can find out more at agebrightly.co.nz.
We certainly love your feedback, and any questions you have, please send them in. You can message us on our Facebook or Instagram. The links are in our show notes.
See you next time on The Next Bit.